A prospective evaluation of succinct prednisone tapering after brain tumor irradiation in dogs. Introduction. Brain tumors are among the most common intracranial neoplasms diagnosed in dogs, with examples including meningioma, glial tumors, pituitary macrotumors, and various metastatic brain tumors. Radiotherapy RT, especially definitive intent RT, e.g., conventionally fractionated RT, CFRT, stereotactic radiotherapy, SRT, and stereotactic radiosurgery, SRS, is an important therapeutic option for treating these tumors. RT, while effective, can lead to several forms of neurotoxicity, such as acute, early delayed, or late-onset neurotoxic effects, which may manifest as neurological deficits. In veterinary practice, it is common to prescribe glucocorticoids like prednisone for patients undergoing brain irradiation to mitigate these potential neurotoxic effects. The rationale for prescribing prednisone is largely anecdotal, with the goal of reducing inflammation, edema, and the severity of RT-induced encephalopathies. However, prolonged corticosteroid use can lead to adverse effects, including polydipsia, polyuria, polyphagia, weight gain, and even gastrointestinal ulceration. Despite the potential risks, prednisone is often tapered slowly over several weeks to months after completing RT, based on individual clinician recommendations. The goal of this study is to evaluate the safety and efficacy of the succinct prednisone tapering protocol for dogs undergoing brain tumor irradiation. Specifically, the study investigates whether a rapid tapering regimen could minimize long-term corticosteroid use without increasing the risk of neurological complications or adversely affecting quality of life, QOL, and survival outcomes. Materials and methods. Study design. This was a prospective observational study involving 55 pet dogs undergoing brain tumor irradiation. The dogs were divided into two groups. 1. Rapid taper group, 19 dogs, treated with a newly introduced rapid prednisone tapering protocol, designed to minimize the duration of corticosteroid use. 2. Slow taper group, 36 dogs, a retrospective control group treated with a traditional slow tapering regimen, where prednisone doses were tapered more gradually according to individual clinician preferences. The primary outcomes evaluated included the time to lowest prednisone dose, the proportion of dogs successfully tapered off prednisone, neurological complications, survival outcomes, changes in quality of life QOL using the Canine Brain Quality of Life (CAN-BRAIN QOL) questionnaire. Study population. Dogs included in the study were diagnosed with intracranial neoplasms using MRI or CT imaging. None of the tumors had biopsy confirmation. The majority of dogs had meningiomas, gliomas, pituitary macroadenemas, or trigeminal nerve sheath tumors. Dogs were excluded if they had significant systemic diseases that could interfere with RT or prednisone treatment. Prednisone tapering protocols. The rapid taper group followed a standardized tapering protocol. See Table 1 in the article. The tapering schedule varied depending on how long the dog had been on prednisone before starting RT. Group 1. Dogs not on prednisone before RT, 5 fractions or fewer, had no prednisone prescribed after completing RT. Group 2. Dogs not on prednisone before RT, 6 fractions or more, had a gradual taper over 2-3 weeks after completing RT. Group 3. Dogs on prednisone for 1 month before RT had their doses tapered over 1-2 months. Group 4. Dogs on prednisone for 1 month before RT followed a more prolonged taper lasting 2-3 months. The slow taper group followed traditional tapering regimens, which typically took several months. The mean starting dose of prednisone was similar in both groups, approximately 0.55 to 0.70 mg/kg day, but the duration of the taper was much shorter in the rapid taper group. Quality of life QOL evaluation. The CAN-BRAIN QOL questionnaire, a validated tool for assessing QOL in dogs with intracranial disease, was used to measure the owner's perception of their dog's health. The questionnaire included 24 questions across 4 domains. 1. Physical well-being, e.g., mobility, energy levels. 2. Emotional well-being, e.g., social interaction, behavioral changes. 3. Brain-specific concerns, e.g., seizure activity, neurological deficits. 4. Overall visual assessment score VAS for a single score from 1 to 10. QOL was measured at baseline, 2 weeks, 4 weeks, and 6 months after RT. Statistical analysis. Data were analyzed using statistical tests such as the Mann-Whitney U-test, t-tests, ANOVA, and Kaplan-Meier survival analysis. The study was designed as a pilot study, with no formal power calculation to determine sample size. Results. Demographics. The rapid taper group included a mix of breeds, with a median age of 9 years and a median body weight of 26.1 kg. The slow taper group had similar demographics, with a median age of 10 years and a median body weight of 22.2 kg. Tumor types were comparable between the groups, with meningiomas and gliomas being the most common diagnoses. Prednisone tapering. The mean time to starting a prednisone taper was significantly shorter in the rapid taper group, 10.5 days, compared to the slow taper group, 55 days. Similarly, the mean time to the lowest prednisone dose was significantly shorter in the rapid taper group, 41 days versus 117 days. In the rapid taper group, 84% of dogs, 15 out of 19, were successfully tapered off prednisone. compared to 50% in the slow taper group, 18 out of 36. The remaining dogs required ongoing prednisone due to worsening neurological signs during the taper. Neurological outcomes and adverse effects. There was no significant difference in the rate of neurological complications between the two groups. In both groups, approximately 1 in 3 dogs required restarting prednisone due to recurrent or progressive neurological signs. Adverse effects of prednisone, e.g., polydipsia, polyuria, polyphagia, were reported at similar rates in both groups. Quality of life call. The CAN-Brain call scores did not show significant differences between the CFRT and SRT-SRS treated dogs, or between different time points. The overall call remained stable after RT in the rapid taper group, with no significant declines noted over time. Survival. The median overall survival time was 617 days in the rapid taper group and 494 days in the slow taper group. But this difference was not statistically significant. Log rank test p equals 0.36. Most dogs in the rapid taper group were alive at the end of the study period, with a median follow-up time of 398 days. Discussion. Rapid tapering safety and efficacy. This study demonstrates that a rapid prednisone tapering protocol is both safe and effective for many dogs undergoing brain tumor irradiation. The majority of dogs in the rapid taper group were successfully tapered off prednisone within 41 days, without any significant impact on neurological outcomes or survival rates. This is in contrast to the slow taper group, where tapering took significantly longer, 117 days, and fewer dogs were successfully weaned off prednisone. The study also found that there was no significant difference in the rate of adverse neurological events between the two groups, suggesting that prolonged prednisone use may not be necessary in many cases. Implications for corticosteroid use in veterinary medicine. The results of this study align with findings from human neuro-oncology, where short courses of corticosteroids are often sufficient for managing acute radiation-induced encephalopathies. Reducing the duration of corticosteroid therapy may help minimize the risk of corticosteroid-associated morbidity, including gastrointestinal ulcers, weight gain, and immune suppression. Future research should aim to identify which subgroups of dogs are most likely to benefit from rapid tapering protocols or no corticosteroids at all. For example, dogs with small tumors, minimal perilesional edema, and mild neurological signs may be good candidates for accelerated tapering or corticosteroid-free protocols. Limitations. Several limitations were acknowledged in the study. Firstly, the lack of pathological confirmation of the brain tumors means that some dogs may have been misdiagnosed based on imaging alone. Additionally, the study was limited by its small sample size, and quality of life data were only available for the rapid taper group, limiting comparisons with the slow taper group. Conclusion. This study provides strong evidence supporting the use of a succinct prednisone tapering protocol after brain tumor irradiation in dogs. The findings suggest that many dogs can be safely weaned off corticosteroids within a few weeks, with no adverse impact on neurological outcomes, quality of life, or survival. By minimizing long-term corticosteroid use, this approach may help reduce the incidence of steroid-related adverse effects, ultimately improving the overall health and well-being of dogs undergoing brain tumor treatment.